Naloxone is a fast-acting drug that can quickly reverse an overdose by blocking the effects of opioids and restoring normal breathing within 2 to 3 minutes. Naloxone can be given safely to people of all ages, from infants to older adults. It is not addictive and will not harm someone receiving it, even if it is found that they are not overdosing. This includes people who may have unintentionally taken an opioid. If you think someone is overdosing and naloxone is available, call 911 and then administer as quickly as possible. Assess the patient for breathing. If no breathing can be detected, begin CPR. If breathing is detected, remove the nasal spray from the box. Peel back the tab with the circle to open it. Do not prime or test the nasal spray. It contains a single dose of naloxone and cannot be reused. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Lay the individual on their back. Support their neck with your hand and allow the head to tilt back before giving this medicine. Gently insert the tip of the nozzle into one nostril of the individual until your fingers on either side of the nozzle are against the bottom of the individual's nose. Press the plunger firmly to administer the dose. After administering the dose, remove the nasal spray from their nostril. After giving the medicine, move the person to their side. Watch them closely. More than one dose might be needed under some circumstances, especially if an overdose event involves illicitly manufactured fentanyl. You may also give additional doses every 2 to 3 minutes until the person responds or emergency medical assistance becomes available. If possible, note the time of initial dose. Stay with the person until emergency workers arrive. Naloxone is a temporary treatment that does not replace emergency workers' treatment and 911 response. An opioid overdose happens when opioids negatively affect the part of the brain that regulates breathing. During an overdose, a person's breathing can be dangerously slowed or stopped, causing brain damage or death. It's important to recognize the signs and act fast, even before emergency workers arrive. If you are not sure, treat it like an overdose. You could save a life. Signs of an overdose may include unresponsiveness, small constricted pinpoint pupils, falling asleep or loss of consciousness, limp body, slow, shallow breathing, choking or gurgling sounds, cold and or clammy skin, discolored skin, especially lips and nails. Several factors can increase the risk of opioid overdose. This includes someone taking prescribed opioids after surgery, accidentally taking prescribed pain medication sooner than directed, or taking too much. Small children can be at risk of overdose in homes or areas where opioids are not stored properly. Individuals with a history of misuse or addiction are at greater risk if multiple drugs are used, mixed, or taken in conjunction with alcohol. Lastly, naloxone administration is covered by the Good Samaritan Act. The Good Samaritan Act offers legal protection to people who, in good faith, give reasonable assistance to those who are or whom they believe to be injured, ill, in peril, or otherwise incapacitated. The protection is intended to reduce bystander hesitation to assist for fear of being liable for unintentional injury caused by providing emergency care.